Live now. I'm here with Dr. Jamicia Connor. I was going to mess it up, but I appreciate so much that you're here. And Natasha K, as always. And we're talking about navigating the Republican manufactured healthcare crisis. Oh boy, because what we're starting to notice is that there's the first wave, there's the stuff that we can see, and then there's the poison pills that are set to take place tomorrow, and literally the next day, and the next day, and then the next month, and then the next year, and like it's for the rest of our natural lives, what they're trying to end as quickly as possible. So, well, let's talk about it. Go ahead and tell us about your research, Dr. Connor. I'll just say so I don't mess up your first name. I apologize,
Yeah,
but
no,
go
no,
ahead and
no.
tell us about
That's
yourself.
all fun. So hello everyone. I'm so excited to be here. As was mentioned, my name is Dr. Demetria Connor. I am an OBGYN. I am a mother of three, and I am the CEO and founder of Giosara, which is we call it an obstetrical emergency infrastructure company. And if you don't know what that means, I don't blame you because most people don't. Essentially, the take home message is we are working to try to help actually improve maternal outcomes through really tangible interventions. So going to support women when they're in extremis during obstetrical emergencies. And the specifics of that are really not that important, but the important thing is we are working really hard to try to undo a lot of the damage that's being done, and it is an uphill battle in every almost at every step. And that's one of the reasons that we're out here trying to be more vocal, is to help just make people aware about how dangerous things are really becoming for Black women, yes, but for all women and for all people, really. Where our focus is in women and children. But, as you've seen, like once, we're all dependent on each other, right? Once one pillar starts to fall, the others have to hold up more weight. And eventually, like you start to see the corrosion kind of across the board. And that's what we're going to start seeing throughout healthcare.
Absolutely. Natasha, do you have anything to introduce yourself or just add to the concept?
I'll just say I'm just glad that we have this opportunity to talk here because this topic, I was just letting them know, is so important. And with all of the changes and all of the internal destruction that's occurring right now within this regime, and with healthcare and funding and people who just actually have no care at all for Black women and our maternal health. There's an uphill battle, and I hope that this conversation will help everybody just kind of realize just how hard it is, and maybe go away with some tips on things that hopefully we can do, because I would love to be able to help in some way as well.
I we did a pre-meeting and we covered so many important things. And gosh, this issue, the issue of maternal mortality and healthcare access, which has been, and I'm so offended by the fact that it's been completely disregarded by the media, really. Um, you know, the left-wing media, if there even is such a thing, has never bothered to cover um the extent to which women are forced to endure torture right now. And we've seen that again with our political system. They just allow women to just, endure these horrific things, and there's just never any coverage. You mentioned it as the gunman in the room scenario, and that's a way of putting it because the right often talks about how they don't want government to get into the bedroom, but they push through all these policies that do exactly that, especially with regarding healthcare. And so I just want to hear your comments on that and just the reality of what we're facing.
Yeah, I think you know, I like to emphasize to people that this is by intent, this is by design. The things that, 'cause sometimes I think it's framed like, oh, how can they not see what's happening? They see what's happening.
Mhm.
It's just it is a positive effect, to their ends. And so I think that's the one thing that we just have to be clear. I don't think. I mean, yes, there are some very foolish people there, and this is how like right wing conservative conservatism has always operated.
Mhm.
You have the foolishness, the clown, the jester, right? While you have like the mastermind right behind them, a- doing like the deliberate work and the deliberate dismantling. And it's meant to be a distraction, right? So that we don't pay attention, because otherwise no one would tolerate. There's just not a big enough consistency to tolerate, the type of things that they're doing. Um, what functionally, I think for women, what is important to communicate is um, uh, a lot of this rests around white women. Just to be clear, the goal, at least from my interpretation, from everything that I'm reading, is to get white women back in the home. Right. The idea of feminism, the idea of the gains that women have made over the last 30, 40 years are inherently offensive, and are being rightly or wrongly, right, being attributed to it. Everything that you see around us, it's because of women, right? It's very similar to how the one kind of thing that binds them right now, uh more than racism, more than anti-Semitism, more than all of those isms, it's really misogyny,
Mhm.
and it is pretty baked into all of their policies. And you're seeing the direct effect of that. And the stuff that's happening behind the scene, like quiet dismantling of the law and the
Mhm.
legal protections that women have, that is going to be the thing that haunts us for the next 5, 10 years. And people have no idea
Mhm.
what's even happening. Um, and so that's kind of the first thing that I think is important to frame. And then once you have that framing, I think it all kind of makes more sense, right? Just think, if you want women back in the home, what do? Right? You make the conditions that enable a woman to live independently unlivable.
Mhm.
And so it's really easy to target women. I mean, like, if you want to target women, you go after her children, you go after her reproductive health. It's no brainer, right?
Mhm.
Like,
Mhm.
because that really, I'm a mom. I have 3 kids, right? Anyone who's ever been pregnant, I mean, honestly, anyone who's a human who's ever actually taken care of, been in close proximity to a pregnant woman, that's a time of,
Yeah.
significant vulnerability. Just very practically, you literally just can't move as well.
Yeah.
You literally can't. You functionally just can't do the things that you used to be able to do. And so if you're able to control that space, well, then you can functionally control a woman, right? And then all of the subsequent things that happen afterwards. And so it makes perfect sense. And that's why we have always been, trying to explain that, like, listen, this is not about abortion.
Yes.
This is about control. And if you just, think of functionally how what happens during pregnancy, it becomes so clear, their
Yes.
approach.
My my frustration is that we allow the right to control this narrative to such a large extent. I mean, there's few people that just say restrictions on reproductive health care is an act of violence. That's an act of violence. That's a humanitarian, assault, and that is not a legitimate position to have. Like, any restriction on reproductive health care is not a legitimate position, and we shouldn't entertain people that hold that position, and we shouldn't allow them to sit and try to shame us for fighting for women to have rights, and that's what we've allowed to happen for too long, and I really have a lot of fault with the media in this, and I think a lot of this stems from just a denial that women are people. I think that's a big issue that I just wrote an article about that. It acts with children too. They deny that children are human beings, they deny that women are human beings, they deny immigrants are human beings. We've got this epidemic of denial of personhood in this country, and that's what allows them to subject real people to just torture. And at some point, yeah, I mean, we're seeing it in the issue with healthcare and with all the other atrocities going on in the culture today, but it is bigger than that. We have a lot of our narratives have to be changed. I know Natasha
Yeah.
probably has some thoughts on that.
Well, I'm curious, what to you right now is how tell our audience, how some of these policies and laws that this regime is trying to enact right now directly impact um, Black women giving birth and essentially women's health as a whole. What problems are they going to be seeing impacted right now, and what can we see in the very near future if things don't turn around?
Was that question directed to me?
Yes,
Uh,
yes.
so the I think the most kind of immediate and will have a pretty widespread effect is going to be the way that they have dismantled the surveillance infrastructure that protects women, like our health surveillance. Um, the the if you think about it, like for a pretty small amount of dollars, um, we so sorry, I have young kids.
Oh, that's fine.
That's
Never
fine.
apologize. I love
Yeah.
having the little ones involved. It makes me feel better when we have these hard topics.
I love it. Oh, he's wearing his Santa Claus hat. Okay, bye bye, puppy. Mommy's got an interview.
I love that. I love that. That is the best thing ever.
Let's
I
do
that oh, all right,
having
let's get back to the hard work. So, thanks
um
for that interruption, though.
So, PRAMS, which is the pregnancy, monitoring apparatus that has operated for the last 40 years, has essentially been completely gutted. And so, the things that allow us to know that Black women are 3 to 4 times more likely to die in pregnancy, the things that tell us when there are epidemics in postpartum depression, when the spike in overdoses of pregnant women, right? Like how do we know that information? Well, obviously someone has to be collecting data, and it has to be at a scale that no other organization can do, right? There are just certain things that the federal government is the only infrastructure that's really empowered to do. And these large scale surveillances
Mhm,
that happens across the board. I mean, on the environment, they're surveilling on the on health, on like when the next strain of killer gonorrhea is going to emerge, right? Like there's people have to be looking out for those things, and all of
mhm,
that has just been essentially incinerated, for no real reason. Concepts like even the concept to study these things, to study Black maternal mortality, like that idea, that concept that there is a Black maternal mortality crisis is gone from the government language. Like that just isn't a concept anymore. Behavioral health and the research and all of gone.
mhm,
Like, they wiped out complete line items out of the budget. And what that means practically is, medicine by and large is funded by the government, right?
mhm,
Um, for better or for worse, I know there are a lot of ills, there are a lot of things wrong with our academic institutions and our research institutions, but, one thing that they have done fairly well is some of this work, right? And a lot of that is just gone, because the government has just cut those line items, and there's no one else to replace them, right?
mhm,
There's no one else who's going to replace them, and if they do, it's going to be the incentives are going to be completely misaligned. So that's kind of the first thing. Like we're in a syphilis epidemic. We have a shortage of the
yeah,
type of penicillin you have to give pregnant women when they have syphilis. Um, well, who's gonna make that medication? Who's gonna make sure that the pharmaceutical company makes it? Because they do it at a loss, right? No
mhm,
one's making money out of from this, right? Um, those are the things that the government needs to do, and that apparatus has just been. I mean, it might functionally be there. There might be like one poor guy, like in a corner, He has his office, his entire staff is gone, and he like
Yeah.
files a report every week. But that's not. But we both know that like
Yeah.
in reality, like that's functionally the exact same thing as completely eliminating it, except that they don't get the news headline.
Mhm.
And so much is happening. What I point people to is I think it was JAMA that released basically the cover that said that talked about just the damage that has happened to medicine. And these are very, very conservative clinicians that sit
Mhm.
on these editorial boards. And for them to release something that essentially is that, quote, quote, political,
Mhm.
that should scare people. Like that sends
Yeah.
shivers through me because I'm like, oh, it's that bad. I like, because you always hope that like, well, maybe I just have the biased news. Maybe someone else,
Right.
maybe
Yeah.
there's maybe it's actually not that bad. No, but when you see them, because that's basically them saying like,
Yeah. Yeah.
it's there's nothing more to say.
Yeah, and that's why I get so frustrated with the reach across the aisle pressure, which just disregards the facts that they're intentionally killing us. I mean, these are bad faith actors. They're doing deliberately the wrong thing, and it's a long-term plan, it feels like, as if, it's not accidental. They're deliberately just annihilating us. You'd mentioned before unless do you have anything to add to that, Natasha?
Um, no, I mean, I think that you answered my question. It just highlights the danger that we're in right now and um how scary it is that we have a regime
Yeah,
who won't even acknowledge the black what is it, infant mortality rate
yeah,
or maternal, am I saying it right? Mortality or morbidity? I don't
Mhm.
I
Yeah.
Yeah, um, who won't even acknowledge that. I don't know if anybody saw that questioning, I think it was last week with RFK, just refusing to even acknowledge that there was an issue, that Black women are, at much higher rates and percentages experiencing these things because there's already been a lack of healthcare, a lack of resources, a lack of studies surrounding it because essentially people don't care. And I just think that it is purposeful. I mean, the government has been experimenting on women, on Black women, on Indigenous women for decades, centuries. This is nothing new. So it's like you said earlier, Walter. We're just objects,
yeah,
and Dr. Jamesia, you're explaining just how this is playing out in our everyday lives right now. And I hope everybody understands how serious
yeah,
it is and how these things are impacting us, and how, even if we're not talking about mortality, we're also talking about healthcare and science and all of these studies that go for cancer. And we've got hospitals and closures and all of those things happening because of that, which is going to also directly impact us, whether or not we're childbearing. So, yeah.
And I
yeah,
want to emphasize, sorry. And the other thing is, I want to make the data concrete for people because I think sometimes um, data can seem very like, these are just, I don't know, numbers. What do these numbers have to do with anything? And I want to like, parallel California versus Louisiana, right? The two extremes. One that has a maternal mortality rate of about 4 per 100,000, and the other that has a maternal mortality rate of about 60 per 100,000, right?
Mhm.
This is the same country, and this is the effect of the different policies. Now, what is important to know is California has not always been like this, right? Um, and it's not perfect. There's still disparities. There are a lot of places of improvement. So that's the first thing to say. But what this demonstrates is they were able to make a 55% reduction over less than 10 years by taking this data and doing simple things, right? Mandating nurse patient ratios on L&D, right? Um, 140 million of state investment. That is honestly, for these people, that's like chump change.
Mhm.
Yeah.
$100 million, like that's a rounding error.
Right.
That's a rounding error for what the types of budgets we're talking about.
Yeah.
Just so it's just that's what makes it so unnecessary. It's just like it's so it makes it sickening because it's like you honestly wouldn't even miss the money.
Yeah.
You
Preventable.
wouldn't miss the
Yeah.
money. You don't even know, you know what I mean? Like, at that level, like, you
Yeah.
honestly would not even know.
They wanna
You
spend $1 billion on their ballroom while women are just dying in
I mean,
agony.
the government's I mean, the order of magnitude is just so vast. I mean, things that could make such a dramatic difference.
Mhm.
And that just shows you how big of an income disparity there is. Like, things that could make such a dramatic difference. There are people in our country who personally could fund.
Yes.
Right.
Personally, they could just
The
decide, "You know what?
Yeah.
I'm tired of the maternal mortality disparity in this state. I am gonna solve that problem. I am going
Yeah.
to wake up on a Monday, and I'm gonna solve that problem, and I'm not even going to really even miss the
Yes.
money, honestly, because
Well,
I will, by interest, make up, like, in a couple months." Right?
there's a whole
Literally, I mean, that's
class
the math. That's
th
what the math shows us.
there's
This
a whole
money
class
is
that just
doing
prints up
nothing.
money. Yeah.
Exactly,
There's
it's doing nothing for them, nothing. It
Yeah.
literally is doing nothing, and it could be saving people's lives, and that's the part that it makes it sickening. It really is just so absurd.
Yeah.
When you look at the size of these budgets, and that was the thing that really kills me. It's like, oh my gosh, the STI, the whole CDC infrastructure that monitors STIs, it was like 8 people? Like 8 people!
Mhm.
From
You know?
since 2025?
Yeah, like, I
Like
mean, this they're not it's not many people. Like, each of these are small government agencies, in on the big scale of things, right? Um,
Mhm.
doing a tremendous amount of work.
Right.
The money is inconsequential. I mean, come on, like,
Yes.
the whole concept of Doge, it's just like, come on, I mean, just so silly, you know? You must think we're idiots, because the money's inconsequential to the government.
Yes.
Um, and just for what? For what?
Right.
Why?
Yeah.
Why did you do this? For nothing, for no reason except
To hurt people. Yeah. And
right?
it's
Because to hurt people is important though, because that is the thing that it makes women scared. It makes you, you'll think twice about
Comply.
leaving your
Mhm.
husband. You'll think twice about leaving your abusive partner. You'll think twice about whether you should go back to school. You'll think twice about, like, this is all the effects. So if you think
Mhm.
about it, it makes no sense,
By
right?
design. Mhm.
Until you connect it to the fear. Well, then
Mhm.
actually, it makes it. I get
Yes.
it. I get why they did what they did.
Yep, and the prevailing belief that they don't think that women are human beings and in a variety of groups. And I think what you said is something real important. Everybody who's watching has to kind of change their mindset, especially because money is just a construct. They just print it. It doesn't mean anything. It's like the grades you got in grade school. Like I've got an A. I collected all these A's. That means absolutely nothing. And it's like it's entirely built so that abusive, evil people can wield control over us. And we can make the choice. So every time they say, well, who's going to pay for that? We'll just print up money and pay for it because that's all money is. It's printed paper. And we just got to make this morality issue, because it is. We got to start measuring things in terms of human torture, which we can prevent. And so I do. I just applaud you, Dr. Demetria, for the work you're doing and for bringing more attention to this. Thank you. It's so important. The other thing you brought up was the upcoming birth worker crisis. We're going to have a shortage of OBGYNs because, again, just complete ineptitude at every level of the Republican government where they deliberately make it impossible for our needs to be met, not just today, but tomorrow and 10 years from now and 50 years from now, just for the sake of torturing us because they don't believe we're human. So what are your thoughts or more details on that?
Yeah, our profession is in crisis. And I don't I think a lot of people are just have it, just putting their head in the sand. Maybe it's because how we're trained, as OBGYNs, you're just kind of taught to I mean, it's a tough, specialty. Most people don't know this, but, OBGYNs are is a surgical subspecialty. And, whenever you train, in the US medical system, in any kind of surgical subspecialty, it's tough, right? The training is very just brutal. And the thing that you get beaten into you, right, is you just keep going. You just keep moving, keep working, you keep going, you keep swallowing. And that is how you make it through the day, right? And so there are, our field is getting thinner and thinner, meaning literally we can't cover the shifts. And people are burning out and people are miserable. But what do you do? What have you been trained to do? Put your head down. You just keep
Mhm.
working harder. You don't eat lunch. That all has a cost, right? The
Right.
cost is what? Patient care.
Yeah.
Cost is empathy. The cost, I mean, you get nothing in life for free, right? That you take that energy, that display, and you
The
take it for the
cost
summer, right?
yeah. Can I say
Um,
also the cost is actually their own health as well if they're being
yeah,
burnt out to that extent,
yeah.
physically and mentally.
Oh yeah.
Yeah.
Yes. I mean, for female physicians in particular, the cost of mental health, the suicide rate is incredibly high. So all of these things, right? And then now you layer on the legal, how the law has effectively come in and functionally regulated the way many OBGYNs have practiced. And in practice, what's going to happen? It doesn't take a rocket scientist to know, right? I'm married to a rocket scientist, so I know that. But this one doesn't take it, right? To know what's going to happen. Well, of course, new people aren't going to want to enter the profession, and so you see that residency applications are down.
Mhm.
The most in the most restrictive states, I think, almost 20% in Alabama. Um, and then people are
Scary.
leaving, people are retiring. I think over 50% of our specialty is over the age of 50.
Mhm.
So, in the next 10 years, a lot of people are going to be gone. So we're going to be down another 5 to 7,000 OBGYNs. And that's not something you get back overnight, right?
No.
You probably have had the experience of trying to call a practice and try to get on a schedule, right? If you don't have an urgent issue, you're not getting on that schedule. You're not.
For like a
You know?
year, 6 months.
It's like, all right, in June is your appointment,
Right.
or if you're lucky, or in
Oh
October, right?
boy.
And that's why. And that's not going to get better, right? Because if I were to start today to try to make up this workforce, it's going to take me the better part of 20 years to do that because I have to get people through undergrad, I have to get people through medical school, I have to get people through residency,
Mm.
then they have to be junior attendings. I mean,
Right.
that's a lot of mentorship
Yeah.
infrastructure that has to be put in
Sh
place.
A lot of years.
So that's a lot of years. And so we're going to have to figure out what to do. And that's part of the work that we do is trying to figure out, well, how are we going to fill this gap? Like very practically, how are we going to fill this gap? And it's something that keeps me up at night.
Yeah.
I work in a lot of rural hospitals. And there are places that used to have 10 OBs and now have one.
Oh boy.
And that's why I still take so much call. It's because, like, how do you tell someone that has no partners, "No, I'm not gonna take your call." Of course I'm gonna take
Yeah.
it, even if it, like,
Oh.
if even if it's, I have to, like, shuffle all these things, even if, my kids need me to, because of course, like, I mean, like, God bless you, like, for still doing that, because without you, that whole area would have 0
Right.
people, right? And there are several states around this country that are like that. I think in Idaho, the last numbers we saw in most of the geographic except the like the big cities, there's like 21 people or 23, something like that, like an absurd number, like essentially the size of a department. Like that's not a workforce. You're covering the majority of the state. Idaho has lost almost 50% of its OBGYNs. That's over 100 people that have departed in the last 2 years. And then when you when you put on top of that, like the L&D closures, because, newsflash, Medicaid pays for
Mhm.
the great majority of births in this country. When you cut Medicaid like that, I mean, it's got like, where is that gonna go? Because it's very expensive to run a birthing unit, right? It's
Mhm.
very expensive. We have huge liability insurance. You need, 24/7 nursing coverage.
Yeah.
You need, a midwife. And if you're lucky, an OB is backup, right? And then a lot of places you also need anesthesia, right? Because people want like you don't you don't want to have to do your C-section under local.
Mm.
That sounds catastrophic, doesn't it? Well,
Yes.
that's what happens when you don't have an anesthesiologist is you do a C-section under. I'm not lying. You do a C-section under local anesthesia.
Oh, boy.
And can I tell you like that is like torturing somebody?
Yeah. Wow.
So, basically, we're seeing a complete gutting of everything, in terms of anesthesia and anybody who works in healthcare, plus we're seeing burnout, so people are leaving earlier, so there's kinda like this compounding factor where we're just not gonna have adequate healthcare or members
Right.
people qualified to I don't know, what do you see is going to happen? I mean, what's our scenario we're looking at? It sounds devastating.
Yeah, I think it is gonna be devastating. I think people are gonna recognize, unfortunately, when, they're going to try to have a baby and they're gonna have to deliver a baby outside the hospital against their will, because the unit that they thought was there doesn't exist anymore. Um, they stop delivering babies. So that's going to mean very functionally deliveries in emergency rooms. And
Oh gosh.
My
trust me, I'm
God.
sure the ED attendings are having their own version of heart attacks right now. Thinking about that,
Well, they'll
thinking,
get burned out too, right? I mean,
Also, mom with,
you
an
know,
emergency room.
you don't want to do it. Trust me. Like this
Right,
is
right,
not,
right.
they're trained to do emergency C sections, but trust me, nobody you're gonna have a general surgeon doing your C section.
No,
Um,
no.
I
oh, so
mean
they just
that.
haven't done it a lot. It's kinda so
That
they're not
that
very
turns into,
experienced.
Well,
like, a fatal, I
I
would
mean,
say, if they're
they're
not that experienced,
yeah,
that
exactly. Training and having to
yeah,
do it are very different things. But yes, I mean, every to be in an emergency room attending, you have to be
Ugh,
able to, functionally know how to deliver a baby because that's a emergency you're going to encounter. But that's not something they do
daily.
regularly.
right.
They've done it during residency. They kind of we've all kind of, basically done rotations with them, and you have, like, the ED intern there, and you're like,
Yeah,
"Alright, come catch this baby," and it's a very different process because you're there s next to obstetricians, and they're kinda guiding you through it, and it's like a fun, 3 weeks, and then you go off hoping you never have to do it again,
Ugh,
right? And, like, the only time you do it is maybe, like, when your partner is delivering or something, it's just functionally something that you don't have to think about, but yeah, in rural communities, I mean, they're a lot more,
yeah,
they have a lot more, hands-on experience by necessity, but it's still not good.
yeah.
It's still not good. And then, it's one thing to have a term baby, right? Like that baby can deliver itself, honestly. Especially moms who've had babies before, happens all the time, right? Um,
mhm,
but what if you're talking about a 28 weeker, right? I have definitely have been in situations where a patient has delivered a preterm baby in an emergency room and like they didn't even put her in a gurney. They didn't even put her on a stretcher. She's like in her clothes. The baby is like in her pants. I mean, I like kid you not. And because they're scared. People are
yeah,
scared.
yeah,
They don't know what to do, and they freeze.
Mm.
And then, like, of course, I mean, luckily, they we were just down the hall, like, literally running down the hall, and we could come in but we're literally getting her in and doing, like, even the basics, and, you're thinking to yourself, like, "What would you do if I wasn't here?"
right,
What would you do? Or what would you do if I had to, like, drive him from, somewhere else? Like, you didn't have thankfully, labor nurses are really
Mhm.
skilled. Even if there's not a physician in the building, they can do a lot of
yeah,
things, without the physician being there, right? So, they always have labor nurses, like, in the same building, right? Hospitals are big, but, they can be there in 5 minutes. Um, but that's not necessarily gonna be the case if they close down these units. That means functionally what that functionally means is the people, right? The building is still gonna be there. The beds are still gonna be there. It's people. We're not gonna be there.
Yeah.
And,
Yeah.
you know
Well, and they're looking too, and this isn't on top of everything, the restrictions on birth control are coming. I mean, we all know that, and the restrictions on abortion are already there. So it's like they want to just have as many women pregnant as possible and then just have, absolutely no ability for them to receive adequate care. And again, it's just enraging that we consider their side as if they have a reasonable perspective. I mean, this is full out just a humanitarian crisis
Yeah.
against all the women.
We have to consider that though. Like I don't talk about it like it's reasonable.
Correct. Good.
I just don't think we have to have that framing.
Oh, I
Um,
I
and,
agree.
just because I think I know the angst that you have because you sit there and you listen to a podcast and like someone trying to
Ah,
make it rational sense. It's just like, it's like me trying to explain like why my kid is like making trying to make a bridge of pillows
well,
and like trying to add some reason to it.
Right.
Be like, oh, if you
but
no, it just doesn't make any sense.
but
It's
so
like, look,
often
I'm like, stop doing that. You're
yes,
gonna fall and hit your face, right? It's
but
like you just say it doesn't make any sense. Stop doing that. You're gonna hurt yourself. And we
yes,
don't have to keep doing that. And that's part of I think where the media has failed is like
yes.
let's stop pretending like this makes any sense because it doesn't.
And Natasha will attest too. They come after us all the time. We say completely, and these are even the reasonable people we know will sometimes get really mad at us for the language we use. And it's like, please,
You
people.
just
It's like,
have to be real. I don't see it any other way. Um, one of the things another thing that is I coming out of this that I've been learning about is also the fact that, with all of these healthcare cuts and everything, um, there's and just basically like the diminishing of the labor and the education and the work that it takes to become a physician, a doctor, and an
mhm,
OBGYN, any sort of medical or health profession. Is there any really real incentive at this point for, kids who want to go to school to become doctors, when a, they're not being paid enough. B, we're not, this government doesn't take health or anything science seriously. It's like, is there a point to people wasting? To me, like wasting their money on an education that they're trying to downplay and trying not to give us that information. And we just have all of these crises and hospitals closing. What is the incentive when everybody's going to go into this broke and also burnt out because nobody else is there? Like, you know what I mean? It just seems
Yeah, and so this is where we have to you know, so a couple things. So one, you know, young people might have more clarity than we do, right? In what the future is so what I believe is if we pave the way, if we protect their opportunities, they will come. I think young people are gonna. I don't think they're.
mhm,
I think they
mhm,
recognize um, what is happening. Uh, there are a lot of young people who are hungry for opportunities, and the pathways to how you do this are intentionally getting more and more obscured.
mhm.
The programs,
Yeah.
the infrastructure that used to help a young person understand how they go from where they are now, especially if you don't come from a family where people
Mhm.
you have family
Yep.
who's doctors, right? Like how do it seems so obscure. It seems so like, and they purposely again, like this is again the way that they because a part of controlling women, that's one part of it, but the other part is they need to subjugate people of color, specifically black people. They need to destroy the black middle class. And the way that
Mm,
they are functionally doing that is through affirmative action, right? Is go after something that works. You go after the thing that made the first black president, right? Like, then start going after voting rights, right? To make
mhm,
sure that there's no other black
mhm.
representatives, right? And so I think there's still a lot of so as a there are a lot of downsides to being a physician, but there are a lot of positive. Physicians make plenty of money.
Mhm.
Um, I don't wanna, I think we get paid fine. Um, uh, I think and physicians are also empowered, to protect themselves. We're not a disempowered class of people. Uh, we can fight legislatively, with the best of them, and we need to, right? And so
Mhm.
I don't want anyone going home and feeling bad for physicians 'cause that's not what I think the effort needs to be put into. Um, we are dismantling the infrastructure that helps young people achieve anything really.
Mm.
Um,
Mhm.
they want us dumb, stupid, and poor. Unless you're one of them,
Mhm.
um, that's what they want. And if you are, if you're black or brown, they functionally don't want you to be educated. Um, they don't want people like me, right? Because I talk too much. I have too many opinions. It's hard to shut me up, right?
Mm.
Because what does economic, opportunity buy you? It buys you the ability to
Power.
talk,
Yeah.
right? It buys you a little the ability to, separate yourself just a little bit from the system. You're
Mhm.
not so dependent
Mhm.
that
Mhm.
that you can say things that are and they want to get rid of us, right? Like that's very clear.
Mhm.
And so what we need to do is we need to support our young people. We need to support them in becoming physicians because this, if we accept this as the new status quo, we are functionally, um, I mean, we already have the worst health outcomes of the dev- all the high income countries. We are the worst. Um, so we're essentially going to be the richest country with health outcomes on
Yeah.
with middle income countries, at best.
Yeah.
And that's just so stupid. I mean, I don't know how else to say it. It's just so foolish. Because practically what that's gonna mean for regular people is you are going to have a medical problem, someone that you love is going to be sick, and you are
Mhm.
not gonna have the resources to go and help them. The person that you need, the infrastructure that you need is not going to exist, and you don't
Money
wanna
can't even buy it. Yeah.
right? You money can't even buy it, exactly, right? Like, I yeah.
Yeah. It's a crime against humanity is what it is, and, you know, one thing as you were talking, it occurred to me, my my wife, when she came, she was an educator, but we got her degree accredited. What kind of process exists where, people that have been trained abroad can become accredited in practice? Is that I mean, obviously, they put obstacles in her path even to become accredited here, and I'm sure I mean, these obstacles are a thing we have to take down because we have the need, but is that even a possibility somebody could get educated abroad and come here?
It's very hard.
Mm.
The American, medical system is very hard to enter. Functionally, a lot if your medical degree is recognized, it's not recognized from everywhere, but if it is recognized, most people have to redo residency.
How long is that?
And how long anywhere from I think the shortest is like 3 years, to if you're a subspecialist, I mean, that you might be talking about 10 years.
Yeah.
And, this is already someone who, so
Yeah,
it's a pathway, but it's not gonna bring in thousands of people, that's for
it's
sure.
just for
Um,
show so that they can
yeah,
point to it, say,
um,
"That's not an
yeah,
issue without the"
we have to we need to train our own doctors. And then, like, the thing that they're also doing is, trying to basically shut down, any pathway from, like, HBCUs to medical school. Like,
Ah,
they're just trying to get rid of all Black
wow,
physicians,
yeah.
under this whole auspice of wokeness and DEI and whatever other nonsense that they say. Um, and, meanwhile, literally the most incompetent people are telling you that you're that you
Yeah,
it's almost like it's like, this is like a bad joke. It's like
Yeah.
we
it's
It's
gotta
like an
laugh.
episode of Arrested Development.
TV show. It's like, someone
Yeah.
somewhere around here
It's
somewhere, right?
constant, it's
Like, you're
constant, yeah.
like, it's just 'cause it's so
Oh
absurd.
my
It's like
gosh.
it's like, how yeah, but here we are, here we are.
Natasha, I'll defer again. I don't wanna
Oh, what are some things that, people who aren't physicians, just regular everyday people like me, what can we do to, try to combat everything that they're doing, everything that they're taking away, all of the funding, besides protesting? Is there anything that we can do? Can we write our congressmen and can we write our governors, senators? Who can we contact and reach out to, and what can we do on our end to try to help?
Yeah, so I think this is the right time to be asking that question. I mean, the midterms, you need to vote like your life depends on it because it
Mhm.
does.
It does.
And it can't be just something that you talk about or you listen to podcasts about. It has to be something that you bring and talk about in your everyday life.
Mhm.
Right.
You are telling people that you know, that you love. Um, you you're sharing these stories, right? You are telling people about the hundreds of L&D units that are going to be closing. You're asking somebody, "Oh, I heard you're trying to have a baby." Well, do you know that there might not be, you're bringing it
Mm.
into a part of your day-to-day conversation, because until people make it real, it's always gonna seem like an
Yeah.
abstraction until it happens to you, and that's unfortunate, that we have, like, allowed ourselves to fall into that mindset, that it's always over there, but we have to make this a reality
Yeah.
Yeah.
for people. And then also help people connect the dots because they are experiencing this pain. They just might not understand
Right.
why, right?
Right.
We've all been
Yeah.
impacted with our premiums.
Yeah.
Like
Mm.
a lot of people. I mean, I'm
Yeah.
sure people out there have gotten denials from medications. I have complete
Yeah.
just not covered anymore. Just not covered. Um, like I told the story the other day. Like I was on call and I had like a UTI. And I promise you, I didn't even talk to the doctor. I kind of texted one of my colleagues, said, I need to leave this sample because it's a medical sample, they had to like register me. I promise you, I get $1,000 bill. That
Yeah.
whole bill with insurance is $3,400.
Wow.
I
Yeah.
left a urine sample.
Mhm. Mhm.
A and so this is happening. You're getting those bills, right? Like, people are understanding, are feeling the effects,
Yeah.
and need to understand who's responsible.
Yeah.
Like, the Trump administration is responsible, right? Like, that's
But
what
then
we're responsible.
it's
They're responsible.
yeah. But it's also crazy because, they're encouraging women, white women, to stay home and have babies. But how the fuck are they going to do that? Excuse my language, but how are
Yeah.
they going to do
Yeah.
that if the hospital is closed down? Are they that rich that they can take a helicopter to the next county? Like how I it's hurting everybody. It's
Yeah.
hurting them, and it
It
will if it's not.
And it
they
will. And I want people to understand that this is not, again, like, this is not just about abortions. I took care of a couple the other day. She was pregnant, desired pregnancy, she had a miscarriage. Some fraction of those women
Mm.
will have a complication. Normal miscarriage. She hemorrhaged, had to be taken to the emergency room, passed out because she's lost so much blood, had to have an emergency procedure. Like, this is like my Friday, right?
Ugh.
This happens, right?
Yeah.
She has a family, like there was like I couldn't even get in the room. There are so many people, right? Because people don't expect that to be them. So I just want people to understand, like, this stuff happens, right?
Yeah.
And the reason it's not a catastrophe, right? That situation could have been an absolute catastrophe, is because we have the healthcare infrastructure that we have. That someone was able to come here, do a DNC. Otherwise, that could have been a death,
Yeah.
right? She could have
Yeah.
died.
Oh, thank goodness you're there. And I this is so hard, but at the same time, I feel like we need to have this conversation just about every single day. And
Yeah.
I need to become more fluent with this language that you're using, the things you're talking about, so I can bring it to other conversations. I've been scanning through the chat. A lot of my fellow creator friends, there's Evie. I know they'll want to talk to you. And I hope you'll be open to having a lot of other people come and talk to you. And I mean, I think
We're creating some very practical tools.
cool,
We are
good,
creating
good.
because we do a lot of research, and we want to give people speaking points. So you have the numbers
Mm,
at your fingertips. We want you to know that the Texas sepsis rate has increased 50% for miscarriage care, right? Because of the Trump administration. We want you to know that Idaho has lost 43% of its OBs, right? And we want you to know that HIPAA protections are gone,
mm,
right? That the things you tell your doctor can be used to prosecute you now. We
mm,
want you to know that so you can tell people, right? And keep telling them that this is important. The other thing is we want women to start preparing. Like you should not, if you have a reproductive age woman in your household, so this is if you
mhm,
have a daughter, if you're the mom, whatever, aunt, whatever, in your household, this is something that you should be making a plan for, like very deliberately. It should not be um, a situation where you are hemorrhaging in an emergency room and
mhm,
trying to think, who should I call? Because there are, I have taken care of patients who have been discharged from 2, 3, 4 places, come to me and it's like, oh, you have a septic uterus. I don't know why they were discharging you. I don't know why. Like you need an emergency procedure. You're sick. Of course you don't feel well, right? And you need someone to call because this is going to become more and more common as the system starts eroding, as more and more resources start leaking out, as the economy gets worse, right? And there are practical things that people can do, and we want you to do that ahead of time. When you're not stressed, um,
mm.
you should be thinking about contraception. You should be thinking about getting a year's worth of contraception if you can, right? How do you get that? You can do stuff like that. And those are the practical things that we wanna empower people with, and we've developed some tools, to, like, help women, just navigate this, and this is the whole body of work that we're doing and building behind the scene is those sorts of things, so that when you have these questions, there's an actual reliable, person or system to go to when other people are either too scared, which is a lot of healthcare, unfortunately a lot of healthcare leaders, a lot of our professional societies, they're too scared to say anything honest,
Mhm.
um,
Mhm.
or they're corrupt, right? Like the CDC is just unreliable right now, and so what alternative do people really have?
Can you tell us where we can find the list of your
Yeah,
talking points? Sorry, finish your water.
yeah. No, we're gonna be sending them out actually,
Okay.
and we'll start providing it, but, it's gonna be like, that's the purpose of the Labor Collective, and, like, the infrastructure that we're building. We have a Substack presence, but we're not building a Substack. It is we call it a vault, essentially, what's behind, like, the essays and all of that stuff is women's health infrastructure, and so we organize things as like playbooks and packs. And so a playbook would be something like, what do I do when my water breaks? And I'm, whatever, 39
Yes.
weeks. Or what do I do when my water breaks and I'm 33 weeks? And practical tools, kind of like that to try to help women, navigate what is coming. We're a small company. We're small but mighty. We're very hardworking. But yeah, that's kind of the what when you support us, like that's what you're supporting is building that infrastructure.
What's the webpage?
It's laborcollective.com.
Okay.
Um,
Sure.
uh, and if you find a dead link on there, I know that they're there. I am working very hard to finish the website and finish all the infrastructure. But the more that you contribute, the faster we can move. The bigger team I can build. And so yeah, and we're really excited. We've been spending a lot of time building, and are now in like the deployment stage where we're going to start bringing these things to the next step.
I'm still not finding it. How do you spell it? LA is it LA?
Yeah, here, I'll put it in the
Oh,
chat.
Put
perfect.
it in
That's
the
the best one.
chat.
Thank you. I want to make sure people get that. And then we read it out loud so that people that only hear the audio can absolutely find it too. There it is. LABORACOLLECTIVE.com.
Yeah, and
Thank you so
if you just follow our Substack as a paid or unpaid subscriber, you'll get
Oh,
all the information, because we're gonna be sending out right now, we're doing a migration, to one
Yeah.
Substack presence just to make things a little bit more, administratively simplified, and then from there, what's gonna follow is the deployment of all the other infrastructure.
Nice.
perfect. I'm going to put a link to your Substack too. People can find that though too. Natasha, we're closing on the end of time. Any final thoughts?
No, I just want to say thank you. And I hope that we can, talk with you again about this
Oh, yeah.
because, as the months progress and as, legislation changes and, as you get the website up and going and everything, if there's anything that we can bring to the forefront,
Mhm.
any information that is pertinent that we can, let our audiences know so that they can, either take action or prepare. All of this information has been super helpful. So I really appreciate that you
Yeah.
took the time to talk to us
Yeah.
and that I had the chance to talk to you because I learned so much and I'm sure everybody else did too.
Oh,
Yeah,
gosh.
anytime. We want to do these things more, and we have a lot of things like that. We're planning, including inviting other people to build with us. Very similar to like a Substack style
Mhm.
um, uh, thing, but really focused on creators and focused on women. And providing a place where people can, like you said, get this information out in a way that is, easier, more focused, less censorship,
Huh.
and where we can all kind of grow. Well, I take that back. It's not less censorship. I tell people, I'm like, I'm building this with my own money, so I get to exclude the Nazis,
Oh,
the racists,
Yeah,
no, but I just
that
meant
doesn't
from
count.
yeah,
I was just my perspective on, like, what I've been trying to do. It's like
Yeah,
everybody fights us tooth and nail every inch
yeah,
they fight.
exactly. And we're tired
exactly.
of dealing with algorithms and how you do this, and like, let me post more notes. And I mean, this is like it's
Leave that to us.
not yeah,
Natasha and I are fighting with that, and we'll just bring you along, but there's so many great people that we've
Yeah,
met here who are going to wanna elevate your message, and it's so important. Yeah, I think, but I just all the praise in the world for what you're doing. Thank you so much for being here
thank
and
yeah.
you.
Thank
for
you.
fighting for human beings, for that battle. That's so important.
Yeah, I have a daughter. I tell people, like, I have kids. Like
Mhm.
I can't remember the quote, but essentially, like, the the seeds that you're planting now
Yeah,
are not
man.
for you, right? It's for the next generation. And
Exactly.
so when you become discouraged about, like, what we can do now, you're not doing it for now. Maybe there's nothing we can do. Maybe
Right.
it's our next 10, 15 years, but I don't want this to be the rest of her life. I don't want this
Right.
to be the rest of their life.
Yeah.
It can't be. Like, I'm
I
just
can't
like, I as long as I have air in my lungs, like, I just can't accept that.
Right.
Um,
Right.
and, like, that's it. That's as even if I'm fighting by myself, like, that's enough.
Same.
And I think that
Same.
we'll just have to keep that focus.
Yeah, it
Right.
matters for the ones you are able to help, and then hopefully we'll bring them all in at some point, but yeah, we can't step back away from this because this means too much.
Yeah.
Oh, again, thank you so much. Thanks so much,
Yeah.
Natasha, for being here. I always appreciate getting a chance to talk to you too, and I don't know, I'm just sitting here kind of feeling sad and also just angry, and I guess, like, there's a lot to process from this talk, but, yeah, we'll
I feel
definitely
encouraged.
good, I'm
Yeah.
glad that you're encouraged.
Yeah.
I'm glad. I'm glad.
I feel encouraged. I feel like, we've got a lot of information and now, we have something that we can do with it. So,
Well, a lot of people are subscribing to you here, they're saying in the chats. Hopefully, you'll see that. We'll continue to do this. People will
yay.
know,
Yes,
and
please
Yeah.
subscribe there.
Yeah, we would love that. So,
Honor.
thank you.
we'll continue to have these talks until because they can't ignore us. We're not going to be quiet. And
Well,
they
what I'm telling people is you won't be able to ignore this.
No.
It's
no,
gonna affect you. And this is not abstract. This is going to affect you, whether
Yes.
you like it or not. And so we'll see who takes things seriously and starts preparing. But you will, what everything I'm saying, you will come to understand sooner rather than later.
Right.
yes,
Unfortunately, and that's
yes,
that's that's what numbers say. I mean, that's the
Yeah.
math. And that's what the
yes.
the thing I just wanna leave people with. This
Yeah,
is real.
we can't allow them to pressure us. We can't allow them to dismiss us as being alarmists. We can't allow them to try and shame us because we're the ones who are right. We got the facts on our side, and this is going to happen. So be loud and have those conversations in uncomfortable places with people that, don't want to hear it. We got to make them hear it because it's better that they experience the discomfort of an uncomfortable conversation that they have to endure the torment of these kind of healthcare outcomes like we've been discussing. So
Yeah.
it really comes down to that. Oh, Dr. Jamicha, thanks so much. It was just a tremendous pleasure to have you here. I really appreciate it. And Natasha
Thank you
too.
for having me.
And yeah, thanks everybody in the chat. This is going to be ongoing. I'll talk to you whenever I'm able to do it. I think it's wonderful. I'll bring more people into it.
Yes, I would
Yeah.
love that. Thank you.
All right. Thank everybody for joining.
Bye bye.
Bye.
Nice meeting you.